Hi, I'm Dr. Julie Steinauer. Let's talk a little bit more about functional visual fields and why on earth a small one like this, which we've talked about in another field, could affect your child's reading, and where could this possibly come from. All right, now, before I get into all of that, I want to talk to you about how you can connect with us. So if you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can fill out our questionnaire there, or if you want to just schedule a consultation direct with me online about how I could potentially help you with your child and their reading problems, please feel free to go there and click that button and schedule a consultation. Now let's go back. In another video we discussed, when a visual field that's functionally small is existing for your child, which may, obviously they might be a student in school, and it's going to affect them with reading because it's kind of like looking through a small tube. We told you to get out a kind of like a towel tube, like a paper towel tube, look through that. Even if they have smaller ones, you can get a straw and look through that. Some kids, now they're going to probably look a lot like they have ADHD if they've got this really towel tube, teeny tiny straw-like kind of thing that they're looking through and processing the visual world, because they'll be busy moving around, trying to sample things to see more clearly. But what could potentially cause that to happen? Now, sometimes we don't necessarily know. Were they born with it? Did it develop over time? To be honest, it doesn't matter because we're going to treat it all the same. However, for this video, we want to talk about what are some things that could potentially cause this to happen. Now, oftentimes this is going to be a stress response to something that's going on with your child visually. What are some things? Tracking problems can cause us to have a small kind of tube that we're looking through, but it's interesting that that small tube that we look through will also cause us to have tracking problems, so it's a double-edged sword. Other things can be misalignment of the eyes, like a strabismus, where one eye tends to cross in or go out or go up, and the brain is kind of like, okay, well, if that eye is up, I'm not going to pay attention to that. I'll just pay attention to the eye that's focused. And so that might restrict the field that the person is kind of looking through. If they have difficulty, not necessarily with strabismus, with an eye turn, but maybe just coordinating and using their two eyes together. So a binocular vision problem can cause a lot of stress on the vision system and say, hey, well, maybe the brain wants to kind of narrow that down to a towel tube, a smaller area that it can try and control and manage or manipulate. And so that might be another reason why that kind of area that they're looking through, functional visual field, is smaller. Another possibility is amblyopia, where the eye doesn't develop eyesight as well in one particular eye for whatever reason. And we've talked about that in lots of other videos, so if you don't know what amblyopia is, go check out one of my amblyopia videos. There are many reasons then. Someone could have had traumatic brain injury, maybe a stroke, and they've it could have caused them to lose full visual field, like not just what we call a functional visual field. Functional visual field is what we deal or function with, but in like the case of a stroke or traumatic brain injury, they may actually have they literally don't have any visual field except for the small area, or a spot up here. And that can be because of hemorrhage or multiple other things that occur with traumatic brain injury. So those are some of the reasons, and you can see I could probably add a lot more to that. There are many different things, like we could talk about nystagmus, we could talk about all kinds of other things that could potentially cause the smaller functional visual field. But what you need to know is what the heck can be done about it. All right, so as we talked about in another video, what we do is we use syntonics, or light therapy filters that trigger the brain electrically to be able to open up and to process more visual space. So to take that teeny tiny functional visual field and to make it into something large and functional, so that a big area of vision is processed all at the same time. And so we use syntonics and vision therapy, which is a little bit more mechanical in nature, of training the brain to function in a lot more areas to be able to process vision. Those two things in conjunction, kind of like the what I call motor, or kind of like a motor or movement oriented type of therapy, like physical therapy for the brain and eyes, and then the light therapy. Those two things together are highly successful in helping us to open up those functional visual fields to help your student or your child to be able to perform better in the classroom. What does that equate to? Well, possibly as much as anywhere from a 3 to 7 grade level improvement in reading in about a 45-week time span. I'll just let that one sit for a minute. Especially if your child is behind or you know that they're exceptionally bright, but for whatever reason they're struggling with reading. 3 to 7 grade levels of improvement in 45 weeks. 45 weeks is a long time. 3 to 7 grade levels of improvement is a pretty huge jump. Now, if you'd like more information, give us a call. If you're local, call us at 618-288-1489. If you're not local, you can go to our website at visionforlifeworks.com. Either click on the schedule a consultation or click on the button to be able to fill out a questionnaire for us. Either way, you'll get to talk to us. It's just one is faster. Schedule a consultation. You meet with me directly right after you schedule that. And if you like the video, pass it on. We would love for you to be able to help someone out with this information. If you haven't done so already, like and subscribe to our YouTube channel. And anything else? Oh, you can also go follow us over at Rumble. All right, thanks so much.